Indeed, these days we talk about climate change as in it started as like global warming. So the science was very clear that this was about carbon emissions and we need to reduce carbon emissions. So I think the whole universe rallied around that notion because science was pointing us to a problem, a challenge that was somewhat even technical in nature. We looked at conservation, we looked at biodiversity, but I think this COP was very different in that we celebrated the first health day ever at COP. And I just want to applaud, the efforts of many organizations, including the WHO, UNFPA, Margaret Pike Trust, the Blue Ventures, who worked very hard with the organizers for COP to ensure there is a health day. Because after all, the climate change agenda is about people. Yes, it's about our planet, but it's about people. So what I learned is that it is possible to push an agenda until it is heard, because we did have our first health day. But what we actually learned as we were zeroing in on what that first health day means is that looking at the issues that we talk about, like adaptation, like building resilience for people, especially for them to respond better for climate change issues, we need to be investing differently within that framework. Matt, we've got 5% of the climate change funding that goes to health. And of that, less than 1% goes to SRHR. That, for me, is still a tragedy. We need to do more. And I felt that there is an opportunity, openness, and willingness for people who are working in the climate change agenda, because now we're not even talking about global warming. We are talking about global burning, of course, literally, because I was in Dubai where it was very hot, even though they were saying it's winter. The climate change effects are real. We are seeing how they're affecting women and girls all over the world, who often are the front line workers, who often are the ones who are bearing the burden of dealing with climate change. We don't want to put the adaptation, we don't want to put the resilience efforts upon the shoulders of women solely because they're in the front line, but rather gather together as a globe to make sure that our investment in women and girls ladder up to something more as we all go towards 2030, the Sustainable Development Agenda. Matt, one of the things about climate change and the issues of women and girls is that we have been very careful to make sure that the family planning agenda is not about population control. It's not about responding to population anxiety, because there's no scientific proof, but rather it is about ensuring that every family, every pregnancy is wanted, every family is planned. We invest in women differently because, after all, when you're investing in women, they are better able to plan for their families. They've got reproductive autonomy, they've got reproductive agency, and they can even build better resilience strategies around their communities, around themselves when we're talking about climate change. This is the message that we had for COP, that when we're looking at adaptation, when we're looking about resilience building strategies, whether around health systems or community systems, we need to put women at the center of that particular response. This is a message that for me is clear both in the health community and also in the climate change communities, who for the first time came together to make sure that the intersection between climate and health for once is clarified, and actually we have a unified approach. But more importantly, for me, that reproductive health agenda for women to ensure their resilience is built better was also assured from this conference.